Final boarding call. Flight to London.
On July 20th, 2014, a commercial flight landed in Lagos, Nigeria. Among its passengers was a Liberian-American government official named Patrick Sawyer. He was visibly ill. Within hours of arrival, collapsed inside the airport terminal. By the time he was transported to a hospital, the clock had already started.
In early 2014, West Africa was facing the largest Ebola outbreak in recorded history. The virus had emerged months earlier in Guinea before spreading rapidly to Liberia and Sierra Leone. Entire communities were paralyzed, hospitals collapsed under the pressure, families were separated by quarantine lines, and healthcare workers were dying. Ebola spreads through direct contact with bodily fluids, blood, sweat, vomit, saliva. It is not airborne. But once symptoms begin, transmission risk escalates quickly. Fever, weakness, muscle pain, then vomiting, diarrhea, organ failure, internal bleeding.
There was no licensed vaccine widely available in 2014. Treatment options were limited. Survival depended heavily on supportive care. By July 2014, thousands had already died in Liberia. But Nigeria had not recorded a single confirmed case. That would change in less than 72 hours. Patrick Sawyer arrived in Lagos from Liberia via Togo. He reportedly showed symptoms before boarding his flight. At the airport in Lagos, he collapsed. At the airport, he was transported to First Consultants Medical Center in Obalende.
Nigeria just confirmed its first Ebola case.
This changes everything. We need to prepare.
Agreed. Let's review the protocols now.
Initially, his illness was not definitively identified as Ebola. He denied direct exposure to infected individuals, and malaria was considered. Other tropical illnesses were considered. But as his condition worsened, suspicion grew. Blood samples were taken. They were sent for laboratory confirmation. This was not just a medical diagnosis. It was a national turning point. Lagos is one of the most densely populated cities in the world. If Ebola spread here, containment would become exponentially harder. The moment confirmation came, Nigeria activated emergency response mechanisms. An emergency operations center was established in Lagos. Contact tracing began immediately. Contact tracing is methodical. Every individual who had direct or indirect interaction with the infected patient must be identified, monitored daily for up to 21 days, the maximum incubation period. Over 800 contacts would eventually be identified. More than 18,000 in-person visits were conducted. Every handshake examined. Every shared object traced. Speed was critical. Delay in exponential growth. Containment depended on discipline, not panic. Before Ebola was confirmed, several healthcare workers had already been exposed. Among them was Dr. Stella Ameyo Adadevoh, a senior physician at First Consultants Medical Center. When Patrick Sawyer attempted to leave isolation and travel onward, Dr. Adadevoh reportedly refused. Her insistence prevented possible transmission in another city. She later tested positive. On August 19, 2014, she died. In total, Nigeria recorded 20 confirmed cases. 8 people died. They included doctors and nurses who had direct exposure while providing care. They became the human barrier between outbreak and catastrophe. Public health victories are often invisible. They are measured not by what happened, by what was prevented. A secondary transmission chain emerged in Port Harcourt. A contact of the original patient traveled before being fully monitored. This created a new cluster. The threat was expanding, but the response intensified. Monitoring increased. Isolation measures tightened. Daily temperature checks, protective suits entering building. The chain was contained before exponential spread occurred. This containment marked a decisive turning point. While Lagos became the epicenter, a secondary outbreak threatened to destabilize containment efforts. A contact linked to the original case traveled to Port Harcourt, Rivers State. He sought treatment at a private clinic. The physician who treated him was later infected. He continued to see patients before diagnosis. This created a new transmission chain.
The results confirm it. The infection has spread.
Nigeria now faced the possibility of multiple simultaneous outbreak zones.
Stakes have escalated.
Protective gear deployment in Port Harcourt. Containment teams moved quickly. The infected physician later died, but rapid tracing prevented widespread community transmission. The Port Harcourt cluster was contained before exponential growth occurred. This was a decisive moment. The Ebola virus belongs to the Filoviridae family. It attacks the immune system directly. Once inside the body, the virus targets white blood cells, disabling the body's natural defense mechanisms. As it replicates rapidly, it spreads through the bloodstream, damaging blood vessels and impairing clotting mechanisms. This is why, in severe cases, patients experience internal bleeding. But the most dangerous factor is not the symptoms. It is timing. Ebola becomes most contagious when symptoms worsens. In overcrowded hospitals with limited protective equipment, a single exposure can infect multiple healthcare workers within hours. In Liberia, entire hospital units had been infected. Doctors died treating patients. Nurses became patients. Medical systems collapsed under fear and shortage of resources. When Patrick Sawyer arrived in Lagos, Nigeria had no active Ebola treatment center. It had no ongoing outbreak, and it had no margin for delay. In epidemiology, the most dangerous phase of an outbreak is the exponential stage. If one infected person transmits the virus to 2 others, and those 2 transmit to 4, and 4 transmit to 8, growth accelerates rapidly.
In a city like Lagos, with over 20 million residents, exponential transmission could have led to thousands of infections within weeks. Public transport hubs, markets, religious gatherings, the risk was real.
Instead, aggressive contact tracing interrupted the chain. Nigeria repurposed its polio eradication infrastructure to track Ebola contacts. This existing public health framework became critical. Teams were trained quickly. Data was centralized. Monitoring was relentless. Over 800 contacts were traced across Lagos and Port Harcourt. Each individual was visited daily. Temperature checks were documented. Symptoms were recorded. Any sign of fever triggered immediate isolation. Containment is not dramatic. It is repetitive, disciplined, meticulous, and often invisible to the public eye. As news spread, fear intensified, misinformation circulated rapidly, a rumor claiming that drinking concentrated salt water could prevent Ebola spread across social media platforms. Hospitals reported cases of salt poisonite. Some deaths were falsely attributed to Ebola but were unrelated. Information control. In modern epidemics, there are always two contagions, the biological one and the psychological one. Nigeria's public health communication strategy became essential. Daily press briefings were conducted. Accurate information was broadcast across radio and television. Community leaders were engaged. Clarity reduced panic. The global community was watching. By mid-2014, the World Health Organization had declared the West African outbreak a public health emergency of international concern. Airlines considered route suspensions, foreign governments issued travel advisories, economic implications loomed. Nigeria is Africa's largest economy. Relations. Instead, Nigeria's containment efforts were recognized internationally. The World Health Organization later described Nigeria's response as swift and effective. After the final confirmed case recovered or passed away, Nigeria entered a 42-day countdown, twice the maximum incubation period. No new confirmed cases. Each day passed without infection. Each day reduced the probability of hidden transmission. Finally, on October 20th, 2014, 20 confirmed cases, 8 deaths. In a city of over 20 million people, Nigeria's outbreak could have mirrored Liberia's or Sierra Leone's. Instead, it ended in 93 days. The difference was speed, coordination, and the willingness of healthcare workers to act decisively. Dr. Stella Ameyo and others paid the ultimate price. But their decisions altered the trajectory of a nation. Epidemics test more than hospitals. They test systems, trust, discipline, and leadership. For 93 days, Nigeria stood on the edge of a public health disaster and stepped back.